Hi, my name is Jeffrey Newman. I'm a cardiac surgeon who has been in South Florida since 1995. I'm one of the most experienced heart surgeons in South Florida to date. At this point, I feel like I'm a senior surgeon. I have a lot to offer some of the junior surgeons that are coming on staff. I feel like I'm giving back to the next generation of cardiac surgeons. The vast majority of patients that I've operated on are truly gratified that they feel better than when they came into the hospital. They're no longer short of breath or having chest pain, and they get back to their activities of daily living and enjoying their families and or their career. I'm very fulfilled about my career. There's nothing else I would rather do. I'm excited about operating on somebody's heart today as I was 25 years ago. And when we're operating on somebody's heart, we have a plan. We know exactly what we're going to do before we touch the patient. Angiogram's been done, the CAT scan's been done. We know we're going to make the incision. We know what we're going to do to fix the valve. We know how we're going to replace the valve, or we know how many bypasses we're going to do and where all the arteries are. And that's all pre-planned. If I wasn't a physician, what would I do? Believe it or not, I always wanted to be an actor. And about 15 years ago, I was going through amateur acting classes. Doing improv is a lot of fun, but I could never see myself on stage doing it publicly. Something that people might find surprising about me is I'm a retired Ironman triathlete. I've competed in 2 Ironman races in my lifetime. The first one in 2007 happened to be in Kona, Hawaii, and the second one was in Nice, France, 3 years later in 2010. Doing an Ironman race is a mental game. Almost very similar to cardiac surgery. You have a plan and you just follow it through.